Thank you, everybody, for coming today to our Parkinson's presentation by Dr. Lance Lee. And as you all know, Lance Lee is the director of our stroke program at the hospital. And he knows everything there is to know about Parkinson's, and he is going to do a wonderful program. Dr. Lee, go ahead.
Thank you, Melissa. Welcome, everybody. This is a talk about the Parkinson's disease today. I'm going to put some screens here for you to look at, and then we're going to start. This one. Okay.
Go back to slide 1.
Sorry, we're going all the way up to slide 1. Good. Again, welcome everybody. This is Dr. Lance Lee. We're going to talk about Parkinson's disease today. It's a very broad topic. So I'm going to try to give you some very practical information to you and try to give you an overview of what is Parkinson's and how to treat them, what are the symptoms and causes. So we're going to talk about some big pictures of the Parkinson's here today. I'm sure we'll have a lot of questions at the end. So we'll have the question and answer session. And we're planning to lecture about 30 minutes. And then we're going to spend the rest of the time with question and answer. Okay. So let's get started with our first slide here. So I'm sure you heard about Parkinson's disease. You probably have family members or yourself. So Parkinson's disease is a very common disease. There's a little history of Parkinson's disease in the slide here, initially described in 1817 by Parkinson. And mainly it's a motor symptom disorder when it was originally described. But now we know there are more symptoms than just motor symptoms. So we're going to talk about that in detail. So the main problem with Parkinson's disease is the fact that we're losing dopamine. We're losing dopamine in the body, which is essential in your body movement and other bodily function. So that is the essence of this disease. And there's a nice picture on the right side about neurotransmitters and how it works. We have more pictures coming. Let's briefly talk about the epidemiology of the Parkinson's disease. It is a very common disease. I would say the number of Parkinson's patients are almost comparable to like a number of strokes per year. And it does increase with the age. And average age at diagnosis is about 60 years old, and 4% are diagnosed before age 50 years old. So even young people can be affected. And about 1% of the population of age over 60 are affected by Parkinson's disease. In my practice, it is probably one of the top 5 diagnoses that I make in terms of number of the diagnosis that I deal with. So it's a very frequent encounter in my practice. So what is actually happening in the brain with Parkinson's disease? Actually, we talked about a little bit of dopamine level dropping as you get older and as the disease progresses. So there's an area called the substantia nigra. You look at the picture here. That's where the dopamine producing cells are located. And this is the shape of the neuron. We simplified it such a way, showing the axons and soma and the structure of the neuron here. So the location is substantia nigra. So what's happening in the level of actually the cells of substantia nigra is just like this. The left is normal looking cell. The right is the diseased, the Parkinson cell. There's structure called the Lewy body, as you can see in the green. It is accumulation of the protein that shouldn't be there. So this is a culprit of what's happening with the Parkinson's patients. And as you develop these extra material, protein, then the cell tend to die and they stop producing dopamine anymore. So that is the level of cellular level of the Parkinson's disease. So it is pretty striking. These are all discovered in the last, I would say about 20, 25 years. And we're still learning more about Parkinson's disease. So what is happening here is that your dopamine neurons are producing cells, the protein dopamine into the receptors, and the top is a normal sort of transmission that we're showing, and at the bottom is the Parkinson's case, that we're sending less neurotransmitter, which is dopamine, to the other part of the cell here, receptors, so that these can function. So in movement disorders patients, like Parkinson's patients, we're lacking this transmission. So we're getting less dopamine. And as a result, you get typical symptoms of Parkinson's, such as tremor, slow movement, and rigidity, and many more. Let's go to the next slide. So how do doctors actually make a diagnosis of Parkinson's disease? It is actually a very visual diagnosis. So many times doctor like me or movement disorder specialists who deal with this kind of condition a lot, they can just spot the patient right away, actually, even from the distance. In fact, I have a story to tell you. I have my uncle who I haven't seen for about 30 years. And then I happened to see him when he's in the 70s. And when I saw him after 30 years, I found that he had a Parkinson's disease immediately just by looking at him. And it was kind of course, sad moment, but I was able to give him some information, and he received the treatment, and he was much better afterwards. So it is an interesting situation. You can see the patient, and you can see the patient with a diagnosis almost immediately. Of course, we'll do the neurologic examination more carefully, and there are some testing that you can do in case that there's a question about the diagnosis, such as DET scan. And rarely we would order the brain scan, but sometimes brain scan could be useful to rule out other sources of Parkinson's like symptoms. So the message here is it is many times very clinical diagnosis, and a doctor who's experienced can just make a diagnosis almost immediately. The disease actually progresses as you get older, and we have here the 5 stages of Parkinson's disease. So basically the message here is that your disability slowly progresses as you get older, as the stage advances. So you will see the minor symptoms in stage 1 and stage 5. Of course, you're totally disabled, but in between you will go through many different stages involving your motor symptoms. So we have a slide here showing some potential cause of Parkinson's disease. To answer the question of what caused Parkinson's, I guess our answer should be we don't know, but we have some situations that the familial history could be the source, genetic source, but it could be, of course, environmental, like exposure to toxins and chemicals and etc. Things that we have to watch are those pesticides that we may use at home even. And then people who use the well water, which are contaminated with heavy metals, for example. So those are possibly associated with Parkinson's disease. But the truth of the matter is we really don't know what causes Parkinson's disease. The familial situations are definitely there, though. Good example, Michael J. Fox, the famous celebrity, He's Parkinson's is, I think he started like when he was in his 30s. So it's highly suggestive that your condition is genetic, possibly source. But again, most of the time, the Parkinson's symptoms start later in life. So most of them are not genetic based. So these are the potential sources of Parkinson's. Probably we have to be aware of those chemicals and heavy metals, but other than that, not much you can do, unfortunately. So that is Parkinson's disease. Risk factors, let's talk about some of the risk factors of Parkinson's disease. We talked about the age. As you get older, you get more Parkinson's symptoms potentially. Being a male compared to female, and then of course family history. There's an observation, of course, that highest numbers are noted in the white Caucasian population rather than other folks. So that's an interesting fact. And then, of course, we talked about the toxins, and the right corner said medications and other drugs. So there are other drugs that also cause a Parkinson's-like condition. It's not the Parkinson's disease, but they can be come from all these medications, such as like psychiatric antipsychotic medication, for example. But that's not actually the true Parkinson's disease, but they look like Parkinson's disease. Let's talk about some of the symptoms of Parkinson's disease. I think most of you probably heard about the motor symptoms. And the hallmark of the Parkinson's disease is actually slowing of your body. It's not actually the tremor. You don't have to have a tremor to get the diagnosis of Parkinson's disease. So tremor is one of the many Parkinson's disease symptoms and is very visible. So it is certainly very helpful to make a diagnosis, but you do not have to have them. There are other features there, your posture, your facial expression, for example, and your body gets also very rigid. So you feel very stiff as a patient and having difficulty of moving your joints. And you have very poor arm swing when you walk. So again, it's very visible. And then you have potentially shuffling gait as the disease progresses. These are some of the new concept of the Parkinson's symptoms. Actually, we found out that a lot of Parkinson's patients have non-motor symptoms. And this is a summary of what other Parkinson's disease patients have told the doctors what they go through. So good example is depression, anxiety, and even a lot of times they complain of a dizziness. And Parkinson's patients lose the blood pressure many times. And they develop so-called orthostatic hypotension. And they can faint when they get up too soon or when they try to do activity quickly. Sometimes they can faint as a result of that. They would have also other symptoms like intestinal symptoms, constipation as an example. Sometimes they just vaguely complain of my belly is weird, doc, like that. So very non-specific, but it could be just subjective complaint of such. And also people talked about just generalized weakness, aches, blepharospasm, which is a fluttering of the eyes, and their speech also changes with even sometimes swallowing difficulty toward the end of the disease state. And their voice is very soft in general. Very, very unique features of Parkinson's disease that I pay attention to when I see the patient. You may also get an increased sweating. So when you think about Parkinson's disease, not only just the motor symptoms, but you may see all these very unusual non-motor symptoms. So we need to address all these things together with the Parkinson's patients when they complain. Let's talk about the treatment options. The main treatment options are medication and surgery. Of course, we have other modalities that we utilize a lot, and we'll talk about that too. But the medication is the mainstay of the treatment. As we discussed earlier, we're lacking dopamine in our system. The dopamine producing cells in the brain are slowly deteriorating with those accumulation of the protein structures like Lewy body alpha-synuclein, for example. So we're losing the function of those cells, having no dopamine from those cells. So the main treatment is to provide the dopamine to your body somehow. So the goal is to either producing more, levodopa is a one good example that you can take, or we need to somehow preserve the dopamine breakdown so that dopamine can be more available in your system. So a lot of drugs that we listed here, COMT inhibitors, MAO-B inhibitors, those are drugs that help to prevent the breaking down of the dopamine in the system. Because dopamine, once it goes to your body, has to disappear somehow. And that's what the body does. And we are utilizing these medicines to prevent the breakdown so that it can be available in your system longer. We also have a dopamine agonist, which means that it acts like a dopamine, but it's not a dopamine. It just acts on the receptors. And then we also use other drugs like anticholinergics, amantadine, and other multiple agents. Those are on the right side of the slides. And many different forms. Some are through your patches, through the skin, and some are through under the tongue delivery. Actually, there are some with even aerosol nowadays. You can even like a spray through your mouth. So all kinds of different delivery systems have been developed. Some are even surgical through the gut directly to prevent the breakdown of the medication. So many different forms are developed nowadays. Let's go to the next one. So what I'm trying to say here is the main treatment is dopaminergic therapy, but all those minor players are the rest, okay? And those are the adjunct treatment for the Parkinson's patients. But I also want you to pay attention to the others here, and I think we're going to discuss a little bit more about others, but others are the non-medical treatment, including physical therapy, exercise, and of course, practicing healthy diets and etc. So I think we'll have a slide here more about that a little bit. So the big picture is, yes, it is a shortage of dopamine, so we have to provide more dopamine, but there are other adjunct drugs that you can use, and also non-medical treatment. So when the disease progressed and we don't have any more options, after about 12 years, sometimes even shorter, 10 years, some people will run out of the medical options because they don't respond to the treatment anymore. Then we have surgical options for the Parkinson's patients. And the most well-known surgical treatment is deep brain stimulator, which was developed in the 90s, and now it's actually being practiced every day in the certain centers where they take care of the movement disorder patients. So this deep brain stimulator is very effective and pretty safe, and the result is quite astonishing, actually. And once patient has a consultation with a neurosurgeon who does this procedure, they'll get to see before and after the procedure videos of the patients, and they get very impressed by that. And it's actually true. I would say that surgical treatment can be quite effective, but it's a brain surgery. You would have to invade a brain, and there's a hardware material goes into your body. So it is a decision that you're going to have to make very carefully after discussion with your neurologist and neurosurgeon, and even your primary care physician, because of your potential other health issues that may prevent you from going to surgery. So, but it's available for you in case your condition became much worse and when you're out of the medical treatment options. So let's go back to that other treatment options that we talked about. It's very important that we understand the importance of the physical exercise and nutritional support, because this condition is basically, the condition that slows you down. And when you slow yourself down, when you don't move, the body will make a noise. The noise will be such as blood clots. You can get a heart disease. You can get a stroke as a result of not doing physical activity and exercise. So the Parkinson's disease does that. It does your body not moving gradually over the years. So the key here is to understand the condition is such that you have to fight against it. And so one of the effort is somehow you need to move. You need to move and do exercise all the time with help of medication and other mainstay treatment. So stretching helps, of course, bending and moving as much as you could do during the daytime will be very useful. A lot of Parkinson's patients get a frozen shoulder because they just don't move their shoulders. And it's part of their disease, and they don't do any of the shoulder activity, particularly, and that's part of their disease. They just don't move. So you need to move and make yourself very soft in your joint. Otherwise, you will get frozen shoulders, frozen wrist and elbow. So it'll definitely affect you in that way. So you'll get a pain and other musculoskeletal symptoms as a result of the Parkinson's condition. So there has been a lot of research is done for this purpose, and we know the intense complex exercise could really help the patients. Our Glendale Adventist, the rehab department has special Parkinson's disease program where I commonly refer my patient to do these type of exercise and take advantage of it. So if you have a family or friends who have Parkinson's, then I would strongly encourage you to consider those exercise programs provided by those special therapists. So that will be very beneficial for you. Of course, there are other activities that you can do: dancing, tai chi, walking, and swimming, etc. But it's always fun to have somebody teaching you and learn some tricks and learn from the professionals. So that will be something I strongly recommend to the Parkinson's patient. So there are more drugs developing as we speak. New mechanism of action of Parkinson's treatments are being developed. New surgical approaches are developed as well. They're developing also non-invasive approaches, for example, just using the ultrasound technique, for example. So new technology is developing as we speak. Gene therapy is probably a little far away, but all these treatment options are being investigated and looked at. So the message that I want to give all of you is that Parkinson's disease is a condition that is very treatable. So I don't think you should feel discouraged because there are a lot of good treatments available. I know people are usually very, very shocked and sad when I give them the diagnosis of Parkinson's. but compared to other neurological conditions that I deal with, this condition definitely is very treatable. And remember, this doesn't kill you. Parkinson's does not kill you, but it slows you down. So as long as you move and do things and do the activities that you usually do, then I don't want to even call it a disease. I think this is just a condition that just slows you down. So I would like to have that type of positive attitude instead of saying that, oh my goodness, I have a Parkinson's disease. It's a disease that has no cure, it's progressive, and I can die from it. So the message is not like that at all. I think it is a very treatable, and you can do a lot of things with the different treatment options. So let's be positive about that. Okay, so I think this is our last slide. And I think we spent just about 30 minutes. So let's get some questions. Let me see.
Dr. Lee,
Yeah,
I'm going to go ahead and stop the recording.
okay.
Okay, so thank you so much. And then we can go straight into our Q&A.
Okay.